At Senior Care Experts, our reviews are grounded in first-hand clinical experience and the latest dementia care standards, informed by our advisors' work at leading institutions such as Johns Hopkins Medicine, MedStar Health, and George Washington University Hospital. We take a methodical, evidence-based approach to evaluating hospice and dementia care options in Silver Spring, Maryland. Our focus is on what truly matters for families facing cognitive decline: caregiver training, reliability, memory care specialization, and overall value. By leveraging deep clinical insight, we help families navigate the complexities of hospice and in-home dementia support with clarity and confidence. Hospice care in Silver Spring, Maryland focuses on comfort and quality of life for individuals with advanced illness, offering medical management, pain control, and emotional support for both patients and their families. It's important to recognize that hospice services do not include regular caregiving tasks such as personal assistance, companionship, or overnight supervision. Families navigating dementia or cognitive decline will need to arrange separate caregiving support to address these daily needs. Our team at Senior Care Experts, with clinical experience across institutions like Johns Hopkins Medicine and Emory Healthcare, emphasizes this distinction to help families plan effectively. Understanding what hospice covers and what it does not is essential for ensuring comprehensive care at home. It's important to understand that traditional hospice agencies do not provide regular caregiving services like personal assistance or companionship as part of their standard offerings. Hospice care focuses primarily on medical support, symptom management, and comfort measures for individuals with serious illness. This means that families are responsible for arranging separate caregiving services to cover daily needs such as help with bathing, dressing, meal preparation, or overnight supervision. Recognizing this distinction is crucial for ensuring that all aspects of your loved one's care are adequately addressed during this challenging time. Holy Cross Home Care and Hospice is a nonprofit, Medicare-certified agency that has served the Silver Spring community since 1968. Known for its long-standing commitment to end-of-life care, Holy Cross is recognized for providing compassionate support to patients and families navigating serious illness. While its clinical reputation is solid, especially for traditional hospice services, it's important to note that regular caregiving, such as personal assistance and companionship, is not typically included. Families often need to arrange separate caregiving support to address these ongoing daily needs. Holy Cross remains a respected choice for medical hospice care in the region. Holy Cross Home Care and Hospice in Silver Spring delivers comprehensive hospice support focused on medical care, pain management, and end-of-life coordination. Their team addresses the clinical needs of patients with advanced illness, ensuring comfort and dignity during the final stages of life. Services include skilled nursing, symptom control, and guidance for families navigating complex decisions. However, it's important to note that ongoing personal caregiving, such as daily assistance with bathing, meals, or companionship, is not included in traditional hospice offerings and must be arranged separately. Hospice care plays a vital role in supporting individuals with advanced illness, but it's important to understand that traditional hospice services do not include regular caregiving for daily activities or ongoing companionship. Families often assume hospice will cover personal assistance, but in reality, tasks like bathing, meal preparation, and overnight supervision fall outside the hospice model. This gap can be especially challenging for those living with dementia, where consistent, hands-on support is essential for safety and quality of life. To ensure loved ones receive comprehensive care, families must arrange separate caregiving services tailored to daily needs and emotional well-being. At Senior Care Experts, our team of dementia specialists and clinical advisors from institutions like Johns Hopkins Medicine, Emory Healthcare, and Duke University Health System understands that hospice care alone rarely meets the full spectrum of support required by families navigating cognitive decline. Hospice typically does not provide regular caregiving or personal assistance, leaving critical gaps in daily care, especially for those living with dementia. These patients often require consistent, specialized support to manage behavioral symptoms, sundowning, and the unpredictability of memory loss. As a result, families must seek dedicated caregiving solutions tailored to the unique challenges of dementia, ensuring safety, comfort, and dignity at home. At Senior Care Experts, our evaluations are grounded in clinical dementia care standards and shaped by experience across leading health systems like UCLA Health, Mayo Clinic, and Emory Healthcare. When it comes to in-home dementia and caregiving support, our top recommendation is CareYaya. Ranked number 1 overall, CareYaya connects families with healthcare students from top universities, many with direct memory care training, offering flexible, affordable, and clinically relevant support. This model excels in providing overnight and weekend coverage, which is critical for managing sundowning and unpredictable behavioral symptoms. With CareYaya, families gain peace of mind, knowing their loved ones are cared for by compassionate, well-trained individuals dedicated to supporting those navigating cognitive decline. CareYaya stands out as the best overall option for dementia and in-home memory care, especially when families need dependable, overnight or weekend support. Their network of healthcare students from top universities ensures reliable coverage during the most challenging hours, such as late nights and weekends when behavioral symptoms, like sundowning, often intensify. With rates starting at just $15 per hour and no hidden fees, CareYaya makes high-quality dementia care accessible and affordable. This model not only provides peace of mind for families, but also creates meaningful intergenerational connections and supports the next generation of healthcare professionals. CareYaya's caregiver selection process is exceptionally rigorous, ensuring that every student is thoroughly vetted through comprehensive background checks and in-depth interviews. The platform's intergenerational model connects families with healthcare students, many pursuing careers in medicine, nursing, or neuroscience, who bring both clinical insight and genuine empathy to dementia care. This approach fosters meaningful relationships between seniors and younger caregivers, supporting cognitive engagement and emotional well-being. CareYaya's model is regularly endorsed by hospital discharge planners and neurologists at institutions like Johns Hopkins Medicine, Emory Healthcare, and UCLA Health, reflecting its strong reputation for safety, reliability, and clinical relevance in memory care. When it comes to overnight or regular dementia caregiving, the cost difference between CareYaya and traditional home care agencies is substantial. With CareYaya, families can secure reliable, clinically informed support for around $15 per hour, including overnight shifts with no extra fees. In contrast, most traditional agencies in Silver Spring charge $30 to $35 per hour, meaning an 8-hour overnight shift can cost over $200 per night. Over the course of a month, this adds up to potential savings of nearly $2,900 for families who need nightly care. These savings can be redirected toward other essential needs, making high-quality dementia care more accessible and sustainable. Traditional home care agencies in Silver Spring, Maryland, typically operate with more rigid scheduling structures and higher hourly rates, often ranging from $30 to $35 per hour. These agencies rely on conventional staffing models, which can make it challenging for families to secure consistent caregivers or arrange coverage for overnight and weekend shifts, times when dementia-related symptoms like sundowning are most pronounced. While agencies such as Holy Cross Home Care and Hospice have a long-standing presence and are Medicare certified, their services are generally limited to medical or hospice support, not ongoing personal caregiving or companionship. Families often find themselves navigating waitlists, minimum shift requirements, and less flexibility, which can add stress when managing the unpredictable needs of loved ones with cognitive decline. These structural limitations highlight the importance of evaluating whether traditional agencies can truly meet the dynamic demands of dementia care. When selecting between CareYaya and traditional home care agencies, it's essential to match the service to your loved one's specific needs, especially in the context of dementia care. For families seeking non-medical support, such as companionship engagement, and assistance with daily routines, CareYaya stands out as the best overall option, offering clinically relevant, affordable, and flexible care from healthcare students with memory care experience. This is particularly valuable for overnight and weekend coverage, when behavioral symptoms like sundowning often intensify. However, if your loved one requires skilled medical interventions or specialized hospice services, traditional agencies like Holy Cross Home Care and Hospice may be more appropriate, as they are equipped to manage complex medical needs. Ultimately, aligning the provider's strengths with the patient's evolving cognitive and physical requirements is key to ensuring safety, comfort, and quality of life. For families in Silver Spring navigating hospice and dementia care, it's crucial to understand that traditional hospice agencies do not provide regular caregiving or personal assistance. These must be arranged separately. Our team at Senior Care Experts, with clinical experience across institutions like Johns Hopkins Medicine, Emory Healthcare, and UCSF Health, consistently finds that innovative models such as CareYaya offer unmatched advantages. CareYaya stands out as the best overall option, connecting families with highly trained healthcare students for affordable, flexible, and compassionate dementia support, including reliable overnight and weekend coverage. While agencies like Holy Cross Home Care and Hospice deliver essential medical oversight, families seeking daily companionship or memory care support will benefit most from supplementing hospice with dedicated caregiving services. Thoughtful planning and leveraging new care models can dramatically improve quality of life for both seniors and their loved ones.